So we'll go ahead and get started. So I'm Amanda Mixon. I'm a physician at Vanderbilt University Medical Center in the United States and at the VA here as well. And with me is Dr. Sandra Simmons, and we lead the Pilot and Scientific Discovery Core of the USDeN network. We have no relevant disclosures at this time, but we would like to thank the National Institute on Aging for funding the network for another 5 years through the R33 mechanism, our scientific advisory board, and a special thanks to Raha Sharuti and Jonathan Norton, who make the network run so smoothly. So I want to tell you about the USDeN structure, and at the top are our leaders, Dr. Cynthia Boyd and Dr. Mike Steinman, who are on the call today. We have an executive committee that made up of the core co-directors. On the left-hand side, you see we have a scientific advisory board, and there are 3 cores now as part of this new USDeN structure. On the left is the investigator and grant catalyst core, led by Dr. Liz Bayless and Catherine Sarkeesian. And then in the middle, you see the pilot and scientific discovery core that we lead. And then thirdly, the stakeholder engagement core that's led by Dr. Nikki Brandt and Carmen Reyes. So as I mentioned, Dr. Simmons and I co-lead the pilot core. And I want to note that everything that I'm going to discuss today is also on the USDeN website, which you see the address at the bottom there. So the purpose of the pilot awards that we oversee is to support research that's going to expand the quality, quantity, and translational impact of deprescribing research, especially for older adults. We like to fund pilot projects that provide primarily, but not exclusively, to junior investigators to get their careers off the ground. And the projects really should provide key preliminary data, proof of concept, or developmental work that really develops a clear pathway to future and larger scale studies. The request for applications is on the website, and you can find it, like I said, at the link at the bottom of this screen. So I'm going to talk a little bit about the scope of the pilot awards. So as I mentioned, we really want to fund things that are going to have a clear and direct relationship to deprescribing, that it's relevant to older adults, and particularly those who have vulnerabilities such as frailty or Alzheimer's disease and related dementias. And then, as I mentioned before, these pilots really are the material that can lead to future grants and research opportunities, and also enhance people's career development in the area of deprescribing. So just to level set and define what deprescribing is, we like the definition from the University of South Australia, which is that deprescribing is the process of withdrawal, dose reduction, or substitution of an inappropriate, meaning high risk, unnecessary, or low benefit medication supervised by a healthcare professional with the goal of managing polypharmacy, also relevant to those without polypharmacy, and improving outcomes. So for this funding cycle, we do have some priority areas that I want to describe. So we, in general, are interested in funding projects that have deprescribing in a variety of healthcare settings, but those that may be understudied, such as home health or hospice. We're interested in point of care tools that help clinicians and patients and their caregivers to stop or reduce medications. We would like to fund things that have patient-important outcomes in deprescribing. And then finally, the area of pharmacoequity and health disparities. Now, we will obviously, fund things that are not within these priority areas, but we are really especially interested in projects that will address these issues. So we've had 5 cohorts of prior awardees. I won't go through all of them today. That was part of the R24, the original funding for the network. But I will show you the last set of pilot awards that were awarded in 23-24. These were our 4 awardees. And again, their projects range from developing a patient experience questionnaire to shared decision-making aids, large data sets, as Dr. LaRoe's work, and then N of 1 trial. So really a variety of methodologies and different questions surrounding deprescribing. We also had a supplement that focused on how to deprescribe benzodiazepine and related Z drugs or sleep drugs, and how we could maybe substitute or complement treatment for whatever is ailing the older adults using complementary and integrative health approaches. And we had 4 awardees there. And these were some of the projects that were funded through that mechanism. These are still ongoing at this time. And then there was one Alzheimer's disease and related dementia supplement that was also awarded to actually one of our colleagues at Vanderbilt. So just so you get a little sense of how many people's applications we reviewed last time, there were 22 pilot applications, and that's an error 4 received funding. So decent odds, I would say. And we try to elicit feedback from people who have gone through the program before. And so these are just some quotes that we got from them. I think most people would say that it was worthwhile, and that their project really had good input and were able to accomplish something, and hopefully then contributed to their future goals of getting larger grants and more career development in the area of deprescribing. So a few words about eligibility criteria. So anyone with a doctoral degree or equivalent, those are physicians, pharmacists, nurses, PhDs, or some kind of equivalent to that. At the time that the award comes to the awardee, the person must be have a faculty appointment or some equivalent position. So this is a really important point that we do get asked about, because we do have a lot of trainees and postdoctoral fellows who are applying for these. So there has to be a commitment that you will have some kind of faculty job or equivalent at the time that the funding comes through to you. Typically, people are working in colleges, universities, medical schools, and et cetera. And then 1 application per individual, but 2 or more are allowed from the same institution. And people from outside the United States are allowed to submit their application, but it's really important to relate to us how your research study will apply outside of your home country, including the United States, since this is funded by the US government. And we do encourage applicants from underrepresented groups to apply, whether that's racial and ethnic minorities, socioeconomically disadvantaged backgrounds, or people with disabilities. So how much money is involved in the pilot award? So for this award, there are $30,000 in direct costs. The combined direct and indirect cannot exceed $50,000. They will be distributed a little bit earlier than in our prior cohorts. We're aiming for an April or May of 2025. And the funds need to be used within 1 year. We plan to award 2 to 3 awards this year. So we really encourage people to submit a variety of study designs, whether that's getting preliminary data for a larger study, a proof of concept, or some kind of fundamental or foundational developmental work that provides that clear pathway to a larger scale study. Study design, like I said, can be from lots of different choices, whether that might be from, observational studies, secondary data set analyses, qualitative evaluation, implementation science, anything of that sort. What I would say is we are not funding quality improvement work. People who may be in the clinician educator world who have more of an education focus, we're not really funding projects in that vein. So what all do you need to submit? So for this round, we are requiring a letter of intent. It can be a maximum of 3 pages long. I've outlined here what needs to be in that letter of intent. The first page is just administrative information, and then the second and third pages are some more detailed information about the project that you're proposing. A couple of things to note: we do want to hear about, the population, the study design, and importantly, the stakeholder engagement plan with some amount of detail, and whether you're going to be able to do this in 1 year and how. The LOI will be submitted through this web-based portal that's on the website. It is due November 12th at midnight Pacific time. The LOIs will be reviewed by the executive committee, and we will then invite people to submit the full application by the week of Thanksgiving in the US. That's November 26th. We may have that information before that time, but we wanted to say that that's the last date that we would notify people. So we're really looking for feasibility. Have you, addressed all the items on the prior slide, and whether we think this is, a good space to fund for us. If you're invited from that LOI stage to submit the full proposal, then this proposal itself is a maximum of 5 pages. The first page, again, is just a cover page with administrative information. And then we do ask that you have this specific order of sections. So the study aim, significance, the stakeholder engagement piece, which I'll speak to in a minute, innovation, approach, and then your future aims and work that you propose after this pilot. There are some supplemental required materials that do not count towards that 5-page limit. So we gather a half-page project summary that's in lay terms so that people who are non-researchers and stakeholders would understand the project. We ask for an NIH-style biosketch from you as the applicant, your primary mentors, and other co-investigators. Excuse me. There are budgetary forms that have both a summary and justification, as well as scope of work and indicating what the fringe rate agreement is. And for junior investigators, especially, it's important to include a 1-page mentoring plan, the mentor's letter of support, and then again, that critical piece of whether you will be a faculty member at the beginning of the award and what your institution has guaranteed in that respect. So one of the really important things that we review is the stakeholder engagement plan. And it is a requirement to have stakeholder engagement for all of these applications. Some people may have never worked with stakeholders before. And I would say if you haven't, there's a lot of good information on our website under the stakeholder engagement section that describes what stakeholders are, how to engage with them. There are some recordings on there that you're welcome to watch with discussion with stakeholders and how to work with them. So I would say that's a great resource when you're planning your letter of intent. So we think of this as, again, a critical element to your science, that we require participation from at least 2 different types of stakeholders, either as an advisory capacity or as a full member of your research team. Except when there's some reason that would be unusual, I think, for most people, the stakeholders must include an older adult or a caregiver and at least 1 additional community partner, a frontline clinician, a health system administrator, or others, depending on what the scope and focus of your project is. So in the descriptions of how you're engaging the stakeholders, it's important to include a detailed description of who they are and how are they going to relate to the study topic in terms of their organizational affiliation. So like if they're a health system administrator and things like that. And then particularly around the stakeholder or the description about their background and experience as a stakeholder, their motivation for participating, and what kinds of activities are they specifically going to be engaged in for your project. So, we want to hear about how meaningful engagement will happen in the context of your study. So with one or more stakeholders or stakeholder groups, it's important to inform some aspect of your research process. So whether that's the topic selection, the study design, the conduct of the research, and final dissemination. I think the most meaningful engagement really includes stakeholders in all of those activities. And that's really the longitudinal relationship that you can build with stakeholders. That's super important. We want to hear about, why these selected stakeholders, what are the goals that intersect with both the study aims and objectives? And then how are you going to, if you haven't invited them to be part of your team or as an advisor already, how are you going to find them, recruit them, and select them? It's important to have some kind of budget compensation plan that outlines how those stakeholders are going to be compensated for their time and efforts. That's really kind of standard now in working with stakeholders, and a timeline of how their activities are going to coincide with the planned compensation. So they have to be included in the budget, the plan, and justification. Some of the things over the years that we've seen as far as pitfalls in writing up the pieces around stakeholder engagement is misidentifying the people that are in the scientific roles as stakeholders. We really mean this to be as more of older adults, their caregivers, frontline clinicians that are not engaged directly with your research necessarily. So not your inner team of researchers, but that they really sort of advise you. Again, the importance of compensation. So either we've seen no compensation or undercompensating. And then really this lack of a clear explanation of how the stakeholders will connect to the project, what's their role, what are their activities, what level of direct involvement they will have. And then finally, a lack of varied stakeholder representation. So that's why we really have said now we want 2 different types of stakeholders involved, so that richness really adds to your project. So as I mentioned, this is the website with the stakeholder engagement resources for you, and the address is there. I really recommend you taking a look at that, and there's links to other resources there as well. So once you have been invited after the LOI stage to submit a full proposal, you collate all of that into one PDF and submit it at the link that you see there. We have the web-based portal. What happens after that? So as I mentioned, the letter of intent is November 12th. The full applications are due January 31st of next year. They get reviewed, and I'll speak about that in a moment. Then the awards will be announced in the early spring, and the funding will come through in sort of April-May time period of 2025. So as I mentioned, the full proposals get reviewed both by a scientific panel of experts in deep prescribing, but also the stakeholder council. And so just a few words about the scoring criteria. They really mirror the NIH review criteria. So overall impact, innovation, the rigor of the approach, the feasibility. Again, we're looking for that 1-year time frame, the investigators and their environment. How is this going to lead to larger scale work? Again, the stakeholder engagement piece that's so important, the relevance to aging in our priority areas, and the budget. The last 2 categories, the relevance to priority areas and the budget, are not scored in the grant review process, but we do take those into account. So if you are so lucky to be selected as an awardee, there are some expectations and resources available. So during that 1 year, you meet quarterly with myself and Dr. Simmons and to just review how your progress is going, what roadblocks you have, how can we help. At the end of the year, we ask that you submit a progress report that's structured and provided by us. We also are excited to showcase your work at the annual meeting, which I'll talk about in a minute. And then every year after your award, we send you an online survey to see what papers and grants you have gotten since the pilot award and how that's contributed to your career development. So as I mentioned, we have quarterly calls with us, and also we really have tried to set up all of our awardees to have calls with the stakeholder engagement core, particularly at the beginning of the project, to really review their stakeholder engagement plan and see if they have any input about that plan. There are US Deep Prescribing Research Network webinars that we encourage you to view over the year. And then there are some consultative services, typically a question that can be answered in 1 hour of an expert's time. In addition to the pilot program that I've been talking about, there is the Grant Catalyst Scholars Program that is new for this year. It is, we're looking for applicants. Again, similar requirement or eligibility criteria. And it's really for people who are thinking about submitting a deep prescribing related grant proposal next year. So this helps prepare them. What are the components of that program? So there's virtual works in progress meetings with your peers around that grant writing, career development activities, and then obviously access to the network resources. The request for applications has been released and they are due on November 24th. And if you have more questions, the address of the network is there and you can look for the Grant Catalyst Scholars Program. So as I mentioned a minute ago, we do have an annual meeting of the USD Prescribing Research Network, and we have had most of those in person annually. The next one will be just before the American Geriatric Society meeting in Chicago, Illinois on May 7th. So mark your calendars. It's a great way to network with other people around the area of deep prescribing, to hear about what's happening in deep prescribing research, and to share your own work in this area as well. So again, just to review the key dates, the letter of intent coming up November will let you know if you're invited for a full application. The full applications are due the end of January. Awards announced early spring, and funding sort of later in the spring. Any questions you have, you're welcome to email at admin@deepprescribingresearch.org. This is the website for the network. And I think at this point, I'm going to stop, and I'm happy to take questions and have our panelists join us back on camera. And I'm going to stop sharing for the moment. So thank you for listening.
So there's a question in the chat, which maybe Mike or Amanda would want to address, which is, does the faculty physician need to be a full-time position?
I think I would say yes. Now, Mike and Cynthia can jump in if I'm incorrect about that. But I think for a project that is 1 year in length, you really need that protected time to conduct this research because it is pretty limited amount of time for you to accomplish something.
I'll maybe give a slightly different perspective, and I don't think this is something we haven't explicitly discussed, so maybe why. I think that the key thing to keep in mind, and sort of just to re-emphasize what Amanda already said, is the goal of this program is to help people advance in your deep prescribing research career, and it's really designed for people who are interested in doing major and sustained deep prescribing research, moving forward. So the goal is to catalyze that 1 year project that will not only be important unto itself, but will sort of lead you and enhance your ability to go on and then compete for future grants and to progress up that academic or sort of that deep prescribing research pathway. It can be done in an academic institution. It typically is. It doesn't have to be. It can be done in a non-academic institution, as long as that institution and the job description supports that kind of research-focused enterprise. So if you're part-time faculty, but you're all in on this research thing and that's your future, your dream, then like, great, that sounds eligible. If you're like, well, I'm part-time and I'm just doing a little bit on the side and I don't really have a pathway or roadmap to actually moving towards a sustained, research-oriented career where it's a big part of what you do, this is probably less of a good fit, because that evaluation of the project is not only for the project itself, but is about you as an individual and sort of what you're going to do with that project and how you're going to use it to advance your career.
Thanks, Mike.
But if anyone has any specific cases, like am I particularly eligible just for myself and I fit sort of in between the lines, just feel free to reach out to us. We're happy to talk to you one-on-one as well, or now.
I don't see other questions yet, but I'm going to just reiterate the encouragement to put questions in the chat for us to answer.
And while we're waiting for that, maybe I'll ask Nikki if you can add some additional comment. I think the stakeholder engagement component can be intimidating or at least confusing for some who haven't really done much in the way of prior stakeholder engagement research. And the goal here is not to like say that everyone needs to be like a super duper expert in stakeholder engagement to even think about applying. Like, we recognize a lot of people, this is just your first time doing it. And there's a big learning process. But because it is an important aspect, we want people to start thinking about this and think about it seriously and not just like as an afterthought. And we in the network are also here to help you develop your proposal and recognize that we don't expect that everything is going to be like perfect the first time around, but at least give it a decent try. Nikki, anything more you want to say about that?
Oh, Mike, of course I've got more I want to say about that. Yeah, it's such a wonderful opportunity for people who are interested in this space to seek additional guidance. First and foremost, as Amanda mentioned, we've been very intentional with updating resources on our website and helping those that are new to engaging stakeholders in this work. We actually even recently published an article about the model with the USDeN and RICMAR and stakeholder engagement, which actually speaks to more explicitly the reimbursement, the engagement, and the meaningful interaction. And inclusion, really, in the even possibly developing your grant with a stakeholder lens as well. And so that's true engagement from a stakeholder perspective. But we also realize that this might be your first time. So reach out, ask questions. We're here to coach, we're here to guide, and we actually, as a council, meet on a quarterly basis. And it's been not uncommon for people to bring their surveys or tools or resources to us and get some feedback from our stakeholder council. Again, you can read about our council on our website. And Carmen Reyes is my co-lead with the council and just a tremendous resource in herself in our work that we're doing. So we're excited to support you, and feel free to ask any questions. And we feel strongly, again, about encouraging, because the work focuses oftentimes on older adults and or caregiver engagement, to have those as partners in the work that you're doing. So hopefully that adds a little bit more. And I love, Amanda, that you included a quote from a previous investigator that really talked about leveraging the Stakeholder Engagement Council as a resource as part of their work too. So thank you for that.
Great, thank you. The only question I saw was again about faculty positioning being full-time. I think we've addressed that. But feel free to put in other questions in the Q&A option. And if you have, as Mike said, there are more sort of intricacies of your question that are more, on a personal level, you're welcome to email the admin at deprescribingresearch.org, and we will get back to you as well.
Yeah, absolutely. And just to sorry to keep jumping in here, but I just want to reemphasize and make sure that the message that Amanda said really got through, which was that just like for stakeholder engagement, you don't expect everything's going to be perfect on the first pass. We realize that the letter of intent is coming up soon. And that we don't anticipate that every applicant is going to have a perfectly thought out, A to Z research plan, fully formed by the time of the letter of intent. We obviously want people to, do a good job and take it seriously, but to recognize that the letter of intent stage is really just to kind of take the nub of your idea. Have you thought about it? But we don't expect you to have all the details worked out. You have more time to do that once your letter of intent is accepted and passed forward to a full application. But the goal is to kind of get the outlines of what you're doing. Have you thought through some of the bigger picture issues? But we don't expect that, every tiny detail is going to be worked out. And even if it was, there's not enough space in the application to put it in. So.
Thanks, Mike. Well, I don't see other questions. Mike, Cynthia, Sandra, anything else you'd like to add before we close?
I guess just a reminder to folks that I'm sure this recorded webinar will be also posted to the Deprescribing Network website. So if you need to revisit it or go back through any information, you can find it there.
I'll just note within the chat that the Grant Catalyst Scholars Program is also posted with links and updates about that. So would encourage folks to check that out and consider that as well in addition.
Yes, because you can definitely apply to both.
Oh, yes.
One key piece is that the Grant Catalyst program is we want people to be targeting writing a grant. It's not targeted towards writing a pilot award for us. It's targeted towards writing a grant like a K and R, the equivalent kinds of things.
Great point. Okay, well, if there are no further questions, I want to thank everybody again for attending the webinar. And if you haven't already, we encourage you to go to the website and click on the red button that says join the network, and you'll get the network newsletter every month. And that has a lot of information about activities of the network, recent publications in the area of deprescribing, anything that's happening in this space. It's really a wealth of information. And we won't spam you. So with that, thanks everybody for joining, and have a great rest of your day.